Sara Lewis, and I'll be your nurse today doing your physical and hygiene. Can you tell me your name and birthday?
My name is Hunter Sharon. My birthday is March 22nd, 2000.
Okay, and why did you come in today?
I came in to get a physical.
All right. Well, I'll be inspecting you, listening to you, and I'll be palpating using my hands and percussing using my hands. Do you need to pee before we start this?
I do not.
Alrighty. Patient appears well groomed. He's sitting erect but relaxed. His speech is clear and he is cooperative. Tell me where we are right now.
We are at a doctor's office.
And what's the month and year?
The month is April and the year is 2018.
Okay, and you're going to tell me your name and birthday and what you're doing here. What would you do if you saw a house on fire?
I would call 911.
Okay, so he's alert and oriented times 4. His judgment is intact. His speech cadence is good. You're such a pleasant young man. Okay, I'm going to start with your head. Normocephalic at first glance. His hair is evenly distributed. No masses felt. No lesions. No evidence of dandruff or infestations. His face appears symmetrical at rest. There is acne present. His skin is not discolored. It's pink underlying tone. He's got facial hair that's normally distributed. His eyebrows and eyelashes are evenly distributed. Tell me if that hurts.
Nope.
Okay, his frontal sinuses and his maxillary sinuses, no tenderness palpated, no drainage noted of the eyes. Do you wear contacts or glasses?
I do not.
Okay. I'm going to have you hold this out, cover one eye, and read the bottom line for me, please.
428,739.
If you'll cover your other eye and read that line backwards.
937,824.
All right, and uncover both eyes and read it.
Forwards.
Yes, please.
428,739.
Okay, his vision in his left, right, and bilateral are all 20/20 using the Rosenbaum pocket chart. Okay, if you will hold this up to that eye. If you don't care to stand for me. Okay, tell me when you can see my fingers.
I can see him.
Okay, other side.
I can see him.
Okay. His peripheral vision is intact, so with his vision test and his peripheral vision, that is cranial nerve 2 intact. And now I'm going to examine your eyes. I'm going to pull your eyeballs up and your eyelids down. So his conjunctiva is pink and moist. His sclera is white. I'm going to look into your eye. Red reflex noted in the right eye. Red reflex noted in the left eye. Okay, if you'll just look straight ahead for me. His pupils are 6 on the left and right millimeters wide, and they are both round and equal. Okay, I'm going to shine a light into your eyes. Both pupils are equal, round, reactive to light, both to direct and indirect light. Okay, follow my pen light with your eyes only. Okay. Now if you will look at the faraway wall, and then look at the pin light. His pupils were able to smoothly move through all 6 cardinal gazes. No nystagmus noted, no nystagmus noted when he held his lateral gaze. His pupils did converge when he looked to the pin light towards his nose, and they were able to accommodate by dilating slightly when he was looking at the faraway wall and constricting slightly when he looked back to the pin light. Now I'm going to do the cover uncover test if you'll just look straight ahead. Alright, no strabismus noted on the cover uncover test, so that with the cardinal gaze and the lateral gaze, that is optic nerves 3, 4, and 6 intact. Also, no ptosis noted of his eyelids. Okay, now I'm going to have you raise your eyebrows, smile, frown, puff out your cheeks. Alright, cranial nerve 7 intact, and shrug your shoulders. Okay, turn your head towards my hand. Okay, that's cranial nerve 11 intact. I'm going to look at your nose. So his nose appears symmetrical, no swelling on the outside, skin's intact. So looking in the nostrils, his mucosa is pink and moist. There is cilia noted. His turbinates are noted on left and right side, and there is no evidence of deviated septum. Do you have any troubles breathing through either one of your nostrils?
I do not.
Alright, if you will close your eyes for me, I'm going to have you cover up one nostril at a time and smell through the other one. You'll be smelling a spice. Just tell me what it is. Inhale.
Cinnamon.
Okay. Other nostril.
Garlic.
Yes. Did you have any trouble breathing through either one of your nose?
No.
Both nasal passages are patent, and that was cranial nerve 1 intact. Now I'm going to do your ears. Let me know if there's any tenderness. The pinea, tragus, and mastoid were all palpated with no tenderness noted. They appear symmetrical in a line on his little head. Okay. The external ear canal is free of cerumen. His positioning towards his nose, his eardrum, his tympanic membrane is pearly gray, and the cone of light reflection is at 5 o'clock. You look at the other ear. External canal is free of wax. Pointing towards his nose. His tympanic membrane is pearly gray with the cone of light reflex at 7. No earwax noted. There was hair in both ear canals. Both ear canals were pink and intact. And now I'm going to do the Weber test. This is going to involve me striking the tuning fork and placing it on your forehead. I need you to let me know if you hear it equally in both ears or if it's louder in one of your other ears.
equally.
Okay, that's a positive Weber test. And now I'm going to do what's called a Rhine test. I'm going to strike the tuning fork again, and I'm going to place it behind your ear on your mastoid bone. When you stop hearing it, say now, and then I'm going to place it next to your ear, and when you stop hearing it, then also say now.
Now. Now.
I had a positive Rhine test for his left ear. His air conduction is greater than his bone conduction. We're going to do it again on the right.
Now. Now.
Okay, that's a positive Rhine test on this right ear also. The air conduction is greater than the bone conduction. That is intact cranial nerve 8. Okay, clench your jaw for me. His mastoid muscles are equal in strength on both sides. Close your eyes for me. Let me know when you feel the soft touch.
Soft. 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 Soft.
Okay. Next, I'm going to be using a broken tongue depressor for sharp and blunted due to Hunter having difficulty distinguishing between the tip of a Q-tip for blunt and the end of it is sharp. Let me know whether you feel sharp or blunt.
Blunt. Sharp. Blunt. Blunt. Sharp. Blunt. Sharp. Blunt. Blunt. Sharp. Sharp. Blunt. Sharp. Blunt.
Cranial nerve 5 is intact. Now I'm going to look at your mouth. So his lips appear intact. They are slightly dry. They are pink. All his teeth are present. Stick your tongue back in your mouth. He's got good dentation. His mucosa is pink and moist. His hard palate and soft palate are intact, pink and moist. His tongue is pink and moist. No white patches on it. Stick your tongue out. Just his pharynx. Say ah. His pharynx is pink and moist in the back. When he said ah, his uvula raised midline and his tonsils moved medially. Gag reflex is intact. Swallow a drink of water for me, please. He's able to swallow without choking. Cranial nerve 9 and 10 are intact. Stick your tongue out for me, please. His tongue is midline. No tremors noted. Cranial nerve 12 is intact. Thank you. You can put your tongue back in your mouth. Okay, and now I'm going to look at his neck. His trachea appears to be midline. No bulges or deviations noted. His neck appears symmetrical. No masses or deformities noted at this time. Left carotid is +2 amplitude. Right carotid is +2 amplitude. using the bell. No bruise detected on left or right carotid. If you don't care to turn slightly this way, just turn your hips. I'm going to sit to your side a little bit more. And then palpate your thyroid. Okay, swallow. Okay, one more time. Okay. No masses detected on the left or right side. Was that tender for you? Did that hurt?
No.
Okay, no tenderness noted on thyroid palpation. No goiter visible. I'm going to palpate your lymph nodes on your head. Let me know if there's any tenderness. Pre-auricle, post-auricle, occipital, tonsillar, submandible, submental, superficial cervical, posterior cervical, turn your head to the left, deep cervical, turn your head to the right, deep cervical, supraclavicular, infraclavicular. Any tenderness of it? No tenderness or lymph nodes felt in that assessment. I also did part of the lymph nodes for the bilateral upper arms and that, just since I was already there. I'm going to assess your chest now. Or I'll do your bilateral upper arms first. Put your sleeves up. Arms appear symmetrical, no lesions or deformities noted on first glance. Skin is intact, pink underlying tone. Skin is warm. No masses or lesions noted. Hair is evenly distributed, his body hair. Right brachial pulse is +2 the amplitude. Left brachial pulse is +2 the amplitude. Left radial pulse is +2 the amplitude. Right radial pulse is +2 amplitude. Fingernails are rounded, no evidence of clubbing noted. Fingernail angle is 160 degrees. Fingernails appear well kept, no jaggedness, no tearing. They were all even. Cap refill was less than 3 seconds on bilateral upper extremities. So, I'm going to do your back if you want to turn this way. Just move this table all the way. Okay. So, skin appears pink undertone. There is acne present. He does have a little bit of hair sparsely distributed on his back. No deformities noted. He appears symmetrical on both sides. Skin temperature is warm. Okay, if you'll just bend forward for me, just a little bit. No masses noted down his spine. His muscles were firm. No tenseness noted. And now I'm going to percuss using my middle finger of my left hand and my right hand to tap. Percussion was resonant in nature. Now I'm going to listen to his breath sounds. I need you to breathe through your mouth for me. I'll be using the diaphragm. Deep breath. Out. Breath sounds were clear and equal bilaterally. No adventitious breath sounds noted. Take a big deep breath. Chest expansion, posterior thorax was symmetrical and even on both sides. Now I'm going to do test for CVA tenderness. I'll be using this hand against my left hand against his body and tapping with the ulnar side of my right fist. Tell me if there's any tenderness noted. Is that tender?
No.
Okay, no tenderness noted. Okay, you can lay flat if you want. Scoot your head up to the top of the bed for me. All right. I'm going to feel your lymph nodes for your arms if you want to just put your arms like this. So I already did the infra clavicle, so the pectoral. Let me know if there's any tenderness. Pectoral, subscapular, lateral, central. Okay. Was there any tenderness?
No.
Just tickling? Okay, so no tenderness noted. No nodes palpated, and his chest appears symmetrical. No heaves, thrills, or pulsations noted in his chest area. I am able to see his ribs. He's a little on the thinner side. I'm going to, his skin is pink, intact. No lesions noted, no scars noted. He does have chest hair that's evenly distributed. I'm going to locate your PMI. If you don't care to roll on your left side for me. Go towards. Okay. His PMI is located left mid-clavicle line on the 5th intercostal space. So soft light tapping, lasting probably less than half a second. All right, if you will roll back on your back for me. I'm going to listen to his heart sounds using first the diaphragm and then the bell. I'll be naming them my first time through. Apical pulse, or sorry, aortic, pulmonic, Herb's point, tricuspid, mitral. I'll be using the bell. S1 and S2 noted, and all landmarks. S3 and S4 were not heard. There's no friction, murmurs, or rubbing. Okay. Now I'm going to listen to his breath sounds. Breathe through your mouth. Okay. His lung sounds were clear and equal bilaterally. No adventitious breath sounds noted. His respiration rate is, let me count it. I want to listen to your heart rate and count your heart rate for a whole minute. Let me turn my watch to a minute hand. Okay, his heart rate was 74 beats per minute. His respiration rate was 14. His depth and rate are regular. He does not appear short of air. His breathing is effortless. He's not using any accessory muscles or abdominal muscles to breathe. Now I will do his abdomen while he's laying down. I want to tug your shorts down just a little bit. You can put your gown back on if you want, and then I can pull it up for you.
What?
Put your arms back through your sleeves. Okay. Okay. There you go. So his abdomen appears, flex your knees for me. Raise your knees. His abdomen appears flat. He does have hair. It's evenly distributed. His skin is pink, intact. I am going to listen to his vowel sound starting in the right lower quadrant. Vowel sounds are present, and normoactive. There is no tinkling noted. I will listen for his aorta, renal arteries, and femoral arteries using bell for bruits. No bruise noted in the aorta, renal arteries, or femoral arteries. I'm going to do light palpation. Let me know if I'm going to do percussion first. Using my left hand and right hand again. Percussion was tympanic on his abdomen in all quadrants. Now I'm going to start with light palpation. Let me know if there's any tenderness. Any tenderness?
No.
No tenderness noted on light palpation. No masses were felt. I'm doing deep palpation. Checking for liver edge. So I'm able to palpate the right coastal margin of the liver. I'm going to check for rebound tenderness. I'm going to push it and let go. Let me know if it hurts. I'll let go. No rebound tenderness noted on his abdomen. There are no masses felt in any of his abdominal quadrants on light or deep palpation. His abdominal aorta is palpated with 2+ amplitude. Left femoral artery, 2+ amplitude. Right femoral artery is 2+ amplitude. You will straighten out your legs for me. Okay, I'm going to examine his bilateral lower extremities. They appear symmetrical, no deformities noted. His skin is pink, intact, no bruising noted, no varicose veins noted. Hair is evenly distributed. Skin is warm. His feet are a little bit cooler. No edema noted. Cap refill is less than 3 seconds bilaterally on his lower extremities. His right dorsal pedis pulse was +2 amplitude. His left is also +2 amplitude. His posterior tibia right pulse is +2 amplitude. His left posterior tibial pulse is +2 amplitude. Okay. You want to sit up for me? Let's see. I'm going to have you stand up. I'm going to assess your gait. So just take a few steps forward. Even you can walk out of front. Take 2 steps back towards me. Gait was steady, no shuffling noted, no swaying noted. His arms did sway a little bit. Turn around for me. Can you do a deep knee bend, like squat all the way to the floor? A little bit lower than that. There you go. And hop in place. A couple of times. Okay. Gross motor function is intact. Patient was coordinated, able to deep knee bend and hop in place. You'll turn and face off the door. Gonna untie the knot in the back. Okay, so his shoulders are aligned and symmetrical. His iliac crests are aligned and symmetrical. I'm going to have you bend over slowly and touch your toes. I'm going to check you for scoliosis. There's no lateral curvature of the spine. Know that his spinal, his vertebrae, there's no masses felt. Any tenderness?
Nope.
No tenderness. Know that his muscles feel firm but palpable. Stand up for me. So looking at him standing up, his cervical and his lumbar spinal regions are concave as they should be, and his thoracic and sacral spine are convex as they should be. Okay, so you were able to bend forward. Can you bend backwards for me? Okay, can you bend side to side as far as you can? And can you twist from the hips? Okay, and next I'm going to have you just stand with your feet together. Close your eyes. Romberg test was completed. There was no swinging noted. Patient was able to maintain balance with eyes closed. All right, so have a seat. Okay, can you put your chin to your chest? Thank you. Chin to the ceiling. Chin to both of your shoulders. Ears to both of your shoulders. Full range of motion of the cervical spine. Can you raise your hands up from the sides, touch your palms, lift your hands forward, upwards, all the way that you can. Okay, and then put them behind you with your arms up your back as far as you can. Okay, shrug your shoulders forward, shrug your shoulders backwards. Okay, full range of motions of his shoulders. I'm going to feel your joints. Tell me if there's any pain. Is any of that tender? No crepitus, no of his shoulder, elbow, wrist, hand or finger joints. No swelling or redness. Note that his muscle tone in his right arm is as expected. There's no rigidity or flaccidness. There is mild resistance with passive range of motion. Let me know if there's any tenderness. Any tenderness? No crepitus noted in any of his joints. No swelling, no redness, no warmth, like over warmthness. His left arm tone was as expected, a mild resistance with passive range of motion. No flaccidness or rigidity noted. Okay, if you will bend your elbows, straighten them out, turn your palms down, turn your palms up. Full range of motion of his elbows. If you can take your hands and bend them and then flex them up. And then side to side. Full range of motion of his wrist. Bend from the fingers down, first knuckle down, and then up. Spread your fingers, put them together, grasp my fingers. Okay. Full range of motion of his hands and fingers. Spread your fingers apart and try to keep them open even with me trying to close them. Okay. So push me away. Okay, pull me forward. Okay, muscle strength is a +5 on his right side, on his upper arm. Push me away. Pull me forward. Muscle strength is a +5 on his left side. Okay. Close your eyes for me. Close your eyes for me. Tell me if I move your finger up or down.
Up. Down.
Keep your eyes closed and tell me when you feel
touch, touch.
Okay. Soft touch is intact. Now I'm going to try pain. Tell me if you feel sharp, stick, or a dull pain.
Sharp, 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 dull, 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 sharp, sharp.
Okay. So now tell me when you feel the vibration, and then tell me when it stops, and you keep your eyes closed.
Feel. Stop. Feel. Stop.
Alright, sensation is intact for soft, dull, and sharp, and vibration in his bilateral upper arms. Okay, now you can lay back down for me. Stretch your legs out for me. Okay, tell me when you feel touch.
Touch. Touch. Touch. Touch.
Okay, tell me when you feel sharp or dull pain.
Sharp. Sharp. Dull. 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 Sharp. Dull. Dull. Sharp.
Okay, again, tell me when you feel the vibration, and tell me when you feel it stop.
Feel. Stop. Feel. Stop.
Okay, soft touch, dull and sharp pain and vibration sensation is intact in his bilateral lower extremities. Tell me whether I'm moving your toe up or down.
Down. Up.
Okay, positioning of his extremities is intact for his bilateral lower extremities. And I'm going to use the end to test his plantar reflex. Okay, check that on. Okay, toes did flex, so that is a positive plantar reflex and a negative Babinski. And I'm going to have you sit up. Swing your legs over to the side. Okay, cover up your legs right now. I'm going to do your deep tendon reflexes. So I'm going to do your tricep. Loosey-goosey. Have your arm just angle. Okay. Loosey-goosey. Okay. Deep tendon reflex of his triceps were +2 bilaterally. Now when you do your biceps, make a muscle. Okay, relax. Make a muscle. Okay. Okay, his hand did flex forward. That is a positive +2 on bilateral brachial deep tendon reflexes. I'm going to do the brachial radialis. Just loosey-goosey. It's a positive 2+ on his deep tendon brachial radialis. And then I'm going to do your patellar. You'll just uncross your legs for me. Scooch back a little bit so your feet tangle. Okay, that's a +2 on left and right patellar deep tendon reflex. going to plantar flex your right foot and check your Achilles. He plantar flex against my dorsal flexion. I'm going to dorsal flex your foot again. He plantar flex against my hand. That's a +2 on his Achilles bilateral deep tendon reflexes. And now I'm going to check my sheet of paper. Okay. Okay. All right. Close your eyes for me. Hands out. I'm going to trace the letter in your hand. Tell me what the letter is.
A.
Mm-hmm.
B.
Mm-hmm. His graphia is intact. And now I'm going to place objects in your hand with your eyes closed, and you tell me what they are.
Quarter.
Mm-hmm.
Safety pin.
Try that.
Paper clip.
Yes. Oh, sorry, I dropped it.
Paper clip.
Yep.
Quarter. Safety pin.
Mm-hmm.
Safety pin.
Mm-hmm. And set it for me straight. So his AP ratio as anterior chest to side lateral chest is a 1-to-2 ratio, as it should be. And I'm going to have you lay down one more time. I'm going to pull your gown up. I need you to flex your head, and I do not see any hernia noted in his abdomen area. Here's my back. And I think that concludes my full body assessment. Thank you for your time, sir. If there's anything else I can get for you, you just let me know.
Okay.
Thank you.